Welcome back to my YouTube channel. I'm Levi Topisia, and today we are going to discuss about erectile dysfunction in young men aged 20 to 40 years. Erectile dysfunction is a very common disease among young men, yet there are many myths saying that erectile dysfunction only happens in older men and people with diabetes and hypertension. You can have a normal blood pressure, a normal diabetes status, and still have erectile dysfunction. And today, I'm going to unleash several factors that can help you to understand what is happening in your body. The first thing, we are going to discuss about what is erectile dysfunction. Secondly, how does erectile dysfunction works? And thirdly, what are the common myths and misconceptions about erectile dysfunction? And fourthly, what are the key factors that you can do to improve or to heal your erectile dysfunction and never be a weak man again? What is erectile dysfunction? Erectile dysfunction is the ability of the banana, or what we say the penis in scientific term, failing to erect or failing to stand firm to be able to penetrate through the vagina. And this is a very destructive and a very shameful thing for men because men are meant to perform. So, erectile dysfunction can happen even in young men. So, don't be confused. If you have erectile dysfunction and you are a young man, you are not broken, you are in good state. Your nervous system is protecting you. Erection happens from your mind, not from your penis. So, when there's a stimulation in your body, there are signals that are sent to the brain. So, the brain sends the signal back through the spinal cord and activating the parasympathetic nervous system. So, when there is a parasympathetic nervous system activation, there is excessive blood flow to the penis. And when there is excessive blood flow to the penis, plus the vasodilation of the penile vessels, then you experience an erection. When your brain doesn't receive the signals, you will not be able to have an erection because the parasympathetic nervous system is not activated. This is usually the protective mechanism of the body. So the body is trained by itself to protect itself. In an instance, this draws us back to the causes of erectile dysfunction. When you have chronic stress, is a factor that is suppressing the body. The body will focus all its energy to the chronic stress and trying to compensate with what is happening. This is whereby the body creates or generates cortisol hormone, trying to compensate to give the body more energy to fight the chronic stress. Therefore, there will be no energy for the body to do erection because erection is something luxurious. So we can say it's a secondary thing. Another factor that can cause you to have erectile dysfunction is performance anxiety. When you are that young man without experience, you may have performance anxiety. Will I be able to satisfy that woman? If you doubt yourself, you will be able to have erectile dysfunction because you will have depression, anxiety. Another thing, if you have past experience of failure during sex, so this one will bring post-traumatic mental disorder, and this one will give you tension, and therefore your body might not work properly because of the tension. You have that anxiety, and the stimuli might not be taken to the brain. Therefore, you might fail. Another thing that can cause erectile dysfunction is alcohol and smoking. In fact, smoking is a very key factor that causes erectile dysfunction. You are smoking, you are taking alcohol. So these things will drain your body. It will drain your proprioception and you will not be able to have an erection. So if you're a young man, you need to avoid things like alcohol and smoking. If it is a mandatory and a must for you to do all those things, you can do it occasionally to avoid damaging your body as a young man. How can you cure erectile dysfunction? First, you should be able to master stress management. As a young man, you need to master stress management. If you get to master stress management, you will be able to evade a lot of problems. You need to relax. You need to be in a good state of mind for your body to work well. Another thing, avoid drug abuse. Things like alcohol and cigarette will damage your body. It will damage your system. Therefore, avoiding those factors and those drugs will make you a good and a strong man. The third thing that you can do, can you try to exercise? If you go to the gym, take a several step walks every day. This one will strengthen your pelvic floor muscles. This will help to strengthen you and make your pelvic floor muscles strong. This can even cure premature ejaculation. Premature ejaculation is when a man goes only 1 minute in the first shot, 1 minute in the second shot, and so forth. This is embarrassing and can make you even to hate sex. Can you try to exercise every day? If you do exercise every day, this one will strengthen your pelvic floor muscle. You will have a strong erection and also endure long in bed. Exercise is very important for your sexual activity. Never assume exercise. Another thing you can do, you need to take a good diet. You need to have a good sleep. If you fail to have a good diet, your body is like a system. It's like a car. If you fail to fuel that car, it won't drive for long. You should take healthy foods. You know, when you are releasing a sperm, you are releasing proteins, you are releasing the finer components of the body. If you want to be a strong man and endure longer in bed, take good food. Take a balanced diet. Take food rich in proteins, vitamins, and carbohydrates. Having a balanced diet, focusing more on the proteins, will make you a strong man and you can be able to endure in bed. You can also take fruits like watermelon and others, which activate the nitric oxide, which also help in erection. If you are a young man and you have erectile dysfunction right now, it is not the end of you. It is not the end of the tunnel. There is still light. In fact, it's just your system trying to protect you. You are okay. You just need to fix your stress management, go to the gym, avoid drug abuse, and you'll have a good experience in bed. Thank you. If you gain anything from this video, please remember to subscribe this channel. Remember to turn the notification bell and subscribe for more videos. Thank you.